Introduction to Trauma-Informed Care. Trauma-informed care, TIC, represents a paradigm shift in how services are delivered, moving from a focus on what's wrong with you to what happened to you. This approach acknowledges the widespread prevalence and profound impact of trauma on individuals' lives, behaviors, and overall well-being. It integrates an understanding of trauma into all aspects of service delivery, aiming to create environments that promote healing and prevent re-traumatization. The core objective is to ensure that all interactions and services are delivered in a manner that is sensitive to the unique needs of trauma survivors. This foundational understanding is critical for professionals across various sectors, including healthcare, education, social services, and justice systems, to foster recovery and resilience effectively. It emphasizes the importance of understanding the individual's history and experiences to provide truly effective and empathetic support. Implementing trauma-informed care involves a commitment to recognizing the signs and symptoms of trauma in clients, families, staff, and others involved with the system. It also requires actively resisting re-traumatization by designing and implementing services and programs with trauma survivors' experiences in mind. This includes establishing physical and emotional safety, promoting trustworthiness and transparency, fostering peer support, and emphasizing collaboration and mutuality. Furthermore, TIC champions empowerment, voice, and choice for individuals, while also addressing cultural, historical, and gender-specific issues that influence trauma experiences and recovery. These principles guide the development of policies, procedures, and practices that are responsive to the needs of those who have experienced trauma, creating a more compassionate and effective system of care. Understanding trauma, definitions and types. Trauma is defined as an emotional response to a terrible event, like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Longer-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. While these feelings are normal, some people have difficulty moving on with their lives. Psychologists and mental health professionals use various frameworks to categorize and understand the diverse manifestations of trauma. It is crucial to recognize that trauma is not merely the event itself, but rather the individual's subjective experience and response to that event, which can vary widely based on personal history, resilience, and support systems. This nuanced understanding helps in tailoring appropriate interventions and support strategies. Acknowledging the deep personal impact of such experiences. Trauma can be broadly categorized into several types, each with distinct characteristics and potential impacts. Acute trauma results from a single overwhelming event, such as a car accident or a natural disaster, and its effects can be immediate and intense. Chronic trauma involves prolonged and repeated exposure to highly stressful events like domestic violence, child abuse, or ongoing combat, leading to more pervasive and complex psychological and physiological changes over time. Complex trauma, often a result of chronic interpersonal trauma experienced early in life, typically involves multiple traumatic events that are pervasive and often occur within caregiving relationships, profoundly affecting development, attachment, and identity. Furthermore, developmental trauma refers to the impact of early, repeated, and severe trauma on a child's developing brain and body, often leading to significant challenges in emotional regulation, self-perception, and relationships. Understanding these distinctions is vital for accurate assessment and effective, targeted interventions in trauma-informed care. Adverse Childhood Experiences, ACEs. Adverse Childhood Experiences, ACEs, refer to potentially traumatic events that occur in childhood, 0 to 17 years. These experiences include various forms of abuse, neglect, and household dysfunction. Examples of ACEs are physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, mother treated violently, household substance abuse, household mental illness, parental separation or divorce, incarcerated household member. Research has consistently demonstrated a strong dose-response relationship between ACEs and a wide range of negative health and well-being outcomes throughout the lifespan. The more ACEs an individual experiences, the higher their risk for developing serious physical and mental health problems, substance abuse issues, and social challenges in adulthood. Understanding ACEs is fundamental to trauma-informed care, as it highlights the critical importance of early intervention and prevention strategies to mitigate these long-term impacts. Recognizing the prevalence of ACEs allows professionals to approach individuals with greater empathy and to tailor interventions that address the root causes of their present difficulties, rather than just the symptoms. The impact of ACEs extends far beyond childhood, influencing brain development, immune system function, and stress response systems. Children exposed to multiple ACEs may experience chronic stress, which can lead to alterations in brain architecture, particularly in areas responsible for emotion regulation, learning, and memory. This can manifest as difficulties in school, challenges in forming healthy relationships, and increased vulnerability to mental health disorders such as depression, anxiety, and post-traumatic stress disorder, PTSD. Furthermore, ACEs are linked to a higher risk of chronic diseases like heart disease, diabetes, and cancer in adulthood, underscoring the profound physiological consequences of early trauma. Addressing ACEs requires a comprehensive public health approach that focuses on preventing these experiences, supporting families, and providing trauma-informed services to children and adults who have been affected. By understanding the pervasive effects of ACEs, communities and service providers can work collaboratively to build resilience and foster healing across generations. Neurobiology of trauma. Trauma profoundly impacts the brain and nervous system, leading to significant neurobiological changes that affect an individual's thoughts, emotions, and behaviors. When a person experiences a traumatic event, the brain's alarm system, primarily involving the amygdala, becomes hyperactive, triggering a fight, flight, or freeze response. This immediate survival mechanism is mediated by the release of stress hormones like cortisol and adrenaline, preparing the body to react to perceived danger. Chronic or repeated trauma can lead to a sustained activation of this stress response, altering the structure and function of several brain regions. The hippocampus, crucial for memory formation and emotional regulation, may shrink, impairing the ability to process and contextualize traumatic memories. The prefrontal cortex, responsible for executive functions like planning, decision-making, and impulse control, can also be affected, leading to difficulties in these areas. These neurobiological adaptations are the brain's attempt to cope with overwhelming stress, but they can result in long-term challenges in emotional regulation, cognitive processing, and social interaction. The sustained activation of the sympathetic nervous system and the dysregulation of the hypothalamic pituitary adrenal (HPA) axis are central to the neurobiological impact of trauma. This dysregulation can lead to an exaggerated stress response, where even minor stressors can trigger intense physiological and emotional reactions. Individuals with a history of trauma may exhibit hypervigilance, constantly scanning their environment for threats, or experience emotional numbing and dissociation as a protective mechanism. The vagal nerve, which plays a key role in regulating the parasympathetic nervous system, can also be affected, contributing to difficulties in self-soothing and returning to a state of calm. Understanding these neurobiological underpinnings is essential for trauma-informed care, as it helps explain why trauma survivors may react in ways that appear irrational or uncooperative. By recognizing that these responses are often adaptive survival mechanisms, professionals can approach individuals with greater empathy and design interventions that help regulate the nervous system, promote safety, and facilitate healing. This knowledge empowers caregivers to move beyond judgmental interpretations of behavior and instead focus on supporting the individual's inherent capacity for recovery and resilience. Psychological impact of trauma. The psychological impact of trauma can be profound and multifaceted, often leading to a range of mental health conditions and emotional distress. Post-traumatic stress disorder, PTSD, is one of the most well-known consequences, characterized by intrusive memories, flashbacks, nightmares, avoidance of trauma-related stimuli, negative alterations in cognition and mood, and hyperarousal. However, trauma's effects extend beyond PTSD, manifesting as generalized anxiety disorder, panic attacks, and various forms of depression. Individuals may also experience significant difficulties with emotional regulation, struggling to manage intense feelings of anger, sadness, or fear. The pervasive nature of these psychological symptoms can severely impair daily functioning, affecting relationships, work, and overall quality of life. It is crucial to understand that these reactions are not signs of weakness, but rather understandable responses to overwhelming experiences, reflecting the brain's attempt to cope with extreme stress. Recognizing the diverse psychological manifestations of trauma is essential for providing accurate diagnoses and developing effective, person-centered treatment plans. Dissociation is another common psychological response to trauma, serving as a protective mechanism where individuals mentally detach from overwhelming experiences. This can range from mild feelings of detachment from one's body or surroundings to more severe forms, such as dissociative identity disorder. Trauma can also lead to significant alterations in self-perception, with individuals often developing feelings of shame, guilt, worthlessness, or a damaged sense of self. Trust issues are prevalent, making it challenging for survivors to form secure attachments and engage in healthy relationships. Furthermore, trauma can impact an individual's worldview, leading to a sense of hopelessness, cynicism, or a belief that the world is inherently unsafe. These psychological sequelae highlight the need for comprehensive and integrated therapeutic approaches that address not only the symptoms, but also the underlying trauma and its impact on identity and relational patterns. A trauma-informed approach acknowledges these complex psychological effects, providing a framework for compassionate and effective support that fosters healing and empowers individuals to reclaim their lives. Social and behavioral manifestations. Trauma often manifests in observable social and behavioral patterns, as individuals develop coping mechanisms to navigate their internal distress and perceived external threats. These manifestations can include difficulties in forming and maintaining healthy relationships, as trust issues and fear of abandonment or betrayal may lead to social withdrawal or volatile interactions. Some individuals may engage in risk-taking behaviors, such as substance abuse, self-harm, or reckless activities, as a way to numb emotional pain, seek intense sensations to feel alive, or reenact aspects of their trauma. Others might exhibit aggression, irritability, or defiance, which can be interpreted as behavioral problems, but are often expressions of underlying fear, anger, or a desperate attempt to regain control. These behaviors are frequently misunderstood and can lead to further stigmatization and isolation, hindering the healing process. A trauma-informed approach recognizes that these behaviors are often adaptive responses to past trauma, rather than intentional acts of defiance or malice, and seeks to understand their underlying function. Beyond overt behaviors, trauma can also influence subtle social interactions and communication styles. Individuals may struggle with emotional regulation, leading to intense mood swings or an inability to express feelings appropriately. They might exhibit hypervigilance in social settings, constantly scanning for cues of danger or rejection, which can make them appear anxious or withdrawn. Difficulty with boundaries, either being too rigid or too porous, is also common, reflecting a disrupted sense of self and safety in relationships. Furthermore, trauma survivors may struggle with executive functions, such as planning, problem-solving, and impulse control, which can impact their academic or professional performance. Understanding these diverse social and behavioral manifestations is crucial for professionals to avoid misinterpreting behaviors and instead offer compassionate, supportive, and effective interventions. By reframing these behaviors as survival strategies, trauma-informed care fosters an environment of empathy and validation, paving the way for healthier coping mechanisms and improved social functioning. Trauma's impact on development. Trauma experienced at any stage of life can significantly alter developmental trajectories, but early childhood trauma, in particular, has profound and lasting effects. During critical periods of brain development, exposure to chronic stress and adversity can disrupt the formation of neural pathways essential for emotional regulation, cognitive function, and social skills. This can lead to delays or impairments in language development, motor skills, and executive functions like problem-solving and impulse control. Children who experience trauma may struggle with attachment, finding it difficult to form secure bonds with caregivers, which can impact their ability to trust and relate to others throughout life. Furthermore, early trauma can affect a child's sense of self, leading to feelings of worthlessness, shame, or a distorted self-image. These developmental disruptions are not merely temporary setbacks, but can lay the groundwork for long-term challenges in mental health, physical health, and social functioning, underscoring the critical importance of early intervention and trauma-informed care for children and adolescents. As individuals progress through adolescence and into adulthood, the unresolved impacts of trauma can continue to shape their development and life choices. Adolescents with a history of trauma may exhibit increased risk-taking behaviors, difficulties in academic achievement, and strained peer relationships. They might struggle with identity formation, self-esteem, and emotional outbursts, often mislabeled as rebellious or difficult. In adulthood, unresolved trauma can manifest as chronic mental health conditions, substance use disorders, and persistent difficulties in intimate relationships and professional settings. The cumulative effect of trauma on development can lead to a cycle of adversity, where early experiences increase vulnerability to further traumatic events and hinder the ability to thrive. Trauma-informed care across the lifespan aims to interrupt this cycle by providing supportive environments and therapeutic interventions that address the developmental impacts of trauma. By understanding how trauma shapes development, professionals can offer age-appropriate and developmentally sensitive care that promotes resilience, fosters healing, and helps individuals build a foundation for a healthier future. The 4 R's of trauma-informed approach. The Substance Abuse and Mental Health Services Administration, SAMHSA, outlines a framework for a trauma-informed approach based on the 4 R's: realize, recognize, respond, and resist re-traumatization. The first R, realize, emphasizes that all individuals and organizations must understand the widespread impact of trauma and potential paths for recovery. This involves a fundamental shift in perspective, acknowledging that trauma is pervasive and can affect anyone, regardless of their background or circumstances. It requires an organizational commitment to educate staff, develop policies, and integrate trauma awareness into every level of service delivery. This realization moves beyond simply knowing about trauma to deeply internalizing its significance and implications for practice. It is about creating a culture where the understanding of trauma is a shared responsibility and a guiding principle for all interactions. This foundational step is crucial for building a truly trauma-informed system, ensuring that services are designed and delivered with an inherent sensitivity to the experiences of trauma survivors. Subsequent R's build upon this foundational understanding. Recognize involves being able to identify the signs and symptoms of trauma in clients, families, staff, and other stakeholders. This requires specific training in trauma assessment and an awareness of how trauma can manifest in diverse ways, including behavioral, psychological, and physiological symptoms. Respond refers to integrating knowledge about trauma into policies, procedures, and practices. This means tailoring services to address trauma-related needs, providing support that is sensitive to triggers, and fostering environments that promote safety and healing. Finally, resist re-traumatization is a critical principle that guides all actions, ensuring that interactions and interventions do not inadvertently re-expose individuals to traumatic experiences or trigger past wounds. This involves careful consideration of power dynamics, choice, and control, aiming to empower individuals and minimize any potential for harm. By consistently applying these 4 Rs, organizations can create a safe, supportive, and effective environment that facilitates recovery and promotes resilience for all individuals impacted by trauma. Key principles: safety and trustworthiness. Creating an environment of physical and psychological safety is the foundational principle of trauma-informed care. For individuals who have experienced trauma, their sense of safety may be profoundly compromised, leading to hypervigilance and a constant state of alert. Therefore, service settings must be designed and operated in ways that ensure both physical security and emotional reassurance. This includes clear and consistent communication, predictable routines, and transparent policies and procedures. Staff must be trained to understand how their actions and words can impact a trauma survivor's sense of safety, avoiding any behaviors that might be perceived as threatening or controlling. The physical environment itself should be calming, welcoming, and free from potential triggers, such as harsh lighting or crowded spaces. Establishing safety is not merely the absence of danger, but the active creation of an atmosphere where individuals feel secure enough to engage, trust, and begin their healing journey. Without a foundation of safety, other therapeutic interventions are unlikely to be effective, as the individual's nervous system will remain in a state of defense, hindering their ability to process and heal. Trustworthiness and transparency are inextricably linked to safety, forming the bedrock of effective trauma-informed relationships. For individuals whose trust has been violated, often repeatedly, by past traumatic experiences, building new trust is a slow and delicate process. Professionals must demonstrate consistency, reliability, and honesty in all interactions, clearly explaining roles, responsibilities, and decision-making processes. This means being upfront about limitations, maintaining confidentiality, and following through on commitments. Transparency in communication helps to reduce anxiety and fosters a sense of predictability, which is crucial for trauma survivors who may have experienced unpredictability and deception. It also involves being open about the purpose of interventions and the potential outcomes, allowing individuals to make informed choices. By consistently acting in a trustworthy manner, professionals can begin to repair the damage caused by past betrayals and create a relational context where individuals feel respected, valued, and safe enough to share their experiences. This principle emphasizes that trust is earned through consistent, ethical, and transparent behavior, rather than being automatically granted, and is vital for fostering a therapeutic alliance that supports healing and recovery. Key principles: peer support and collaboration. Peer support is a powerful and integral component of trauma-informed care, recognizing the unique value of shared experience in the healing process. Peer support specialists, who have lived experience with trauma and recovery, offer invaluable empathy, validation, and hope to others. They serve as role models, demonstrating that recovery is possible and providing practical guidance based on their own journeys. This form of support can reduce feelings of isolation and shame, fostering a sense of community and belonging that is often disrupted by trauma. Peer relationships are inherently mutual and non-hierarchical, which can be particularly empowering for individuals who have experienced power imbalances in their past. By connecting with someone who truly understands their struggles, individuals can feel less alone and more motivated to engage in their own healing. Integrating peer support into services enhances the effectiveness of care by providing a complementary layer of understanding and encouragement that professional services alone may not always capture. This principle underscores the belief that healing is a collective journey, strengthened by the wisdom and support of those who have walked similar paths. Collaboration and mutuality are fundamental to empowering trauma survivors and fostering a sense of control over their own recovery. Trauma often involves experiences where individuals felt powerless and had their choices taken away. Therefore, a trauma-informed approach prioritizes shared decision-making, ensuring that individuals are active participants in their treatment planning and goal setting. This means working with individuals rather than doing things to them. Then, respecting their autonomy and expertise in their own lives. Collaboration extends beyond the individual-provider relationship to encompass interdisciplinary teams, family members, and community resources, creating a holistic network of support. By fostering an environment where all voices are heard and valued, and where power is shared, organizations can help individuals rebuild trust, enhance their self-efficacy, and develop a stronger sense of agency. This principle recognizes that true healing occurs when individuals are empowered to make choices, advocate for themselves, and actively shape their own path to well-being, moving from a position of victimhood to one of resilience and self-determination. Key principles: empowerment, voice, and choice. Empowerment, voice, and choice are pivotal principles in trauma-informed care, directly addressing the core experiences of powerlessness and loss of control often associated with trauma. By actively promoting empowerment, professionals help individuals recognize and build upon their strengths, fostering a sense of self-efficacy and agency. This involves shifting the focus from deficits to capabilities, highlighting resilience, and supporting individuals in setting and achieving their own goals. Creating opportunities for individuals to use their voice means actively listening to their perspectives, validating their experiences, and ensuring their input shapes the services they receive. This can be particularly healing for those whose voices may have been silenced or dismissed in the past. It is about creating a safe space where individuals feel heard, respected, and understood, allowing them to reclaim their narrative and assert their needs. This principle acknowledges that individuals are the experts of their own lives and possess inherent strengths that can be harnessed for healing and growth. Providing choice is another critical aspect of restoring autonomy and control for trauma survivors. Trauma often involves situations where individuals had no control over what happened to them, leading to a deep-seated fear of being controlled or having decisions made for them. Therefore, offering meaningful choices in treatment, daily activities, and even the physical environment can be profoundly therapeutic. This might include choices about appointment times, therapeutic modalities, or even the seating arrangement in a group session. While choice should be balanced with safety and practical considerations, the emphasis is always on maximizing opportunities for individuals to exert control over their own lives. This approach helps to rebuild a sense of agency and self-determination, which are essential for recovery. By consistently upholding the principles of empowerment, voice, and choice, trauma-informed care actively counteracts the disempowering effects of trauma, fostering an environment where individuals can regain control, make informed decisions, and actively participate in their own healing journey. This not only enhances engagement in services, but also promotes long-term well-being and resilience. Key principles: cultural, historical, gender issues. Trauma-informed care critically acknowledges and addresses cultural, historical, and gender-specific issues that profoundly influence both the experience of trauma and the path to healing. Cultural context shapes how individuals perceive, express, and cope with trauma, as well as their willingness to seek help. Historical trauma, such as the cumulative emotional and psychological wounding across generations resulting from mass group trauma. Example: slavery, colonization, genocide, has deep and pervasive impacts on marginalized communities. Understanding these intergenerational effects is crucial for providing culturally responsive care that respects diverse healing practices and avoids imposing dominant cultural norms. This principle requires professionals to engage in ongoing self-reflection, challenge their biases, and develop cultural humility, recognizing that effective care must be tailored to the unique cultural backgrounds of individuals and communities. It is about moving beyond a one-size-fits-all approach and embracing the richness of diverse human experiences, ensuring that interventions are relevant, respectful, and effective for all. This deep understanding of cultural nuances helps to build trust and rapport, which are essential for successful engagement in trauma-informed services. Gender also plays a significant role in both the types of trauma experienced and their subsequent impact. Societal norms and power dynamics can expose individuals of different genders to varying forms of violence, abuse, and discrimination. For example, women and girls are disproportionately affected by sexual violence and domestic abuse, while men and boys may experience trauma related to combat or societal expectations of masculinity that discourage emotional expression. Trauma-informed care must be sensitive to these gender-specific vulnerabilities and responses, providing safe spaces and interventions that acknowledge and address these differences. This includes understanding how gender identity and expression can intersect with other identities to create unique experiences of trauma and barriers to care. By integrating an awareness of cultural, historical, and gender issues, trauma-informed care moves beyond individual pathology to address the broader systemic factors that contribute to trauma and hinder recovery. This holistic approach ensures that services are equitable, inclusive, and truly responsive to the complex needs of diverse populations, fostering an environment where everyone feels seen, understood, and supported in their healing journey. Screening and assessment for trauma. Effective trauma-informed care begins with appropriate screening and assessment to identify individuals who may have experienced trauma and to understand its potential impact. Screening for trauma involves using brief, validated tools to determine if an individual has a history of trauma or symptoms consistent with trauma exposure. This is not a diagnostic process, but rather a way to flag individuals who may benefit from further assessment and support. It is crucial that screening is conducted in a sensitive, non-judgmental manner, in a safe and private environment, and with clear explanations of its purpose. Universal screening, where all individuals are screened regardless of presenting issues, helps to normalize the conversation about trauma and reduces stigma. The goal is to identify trauma history early, so that services can be tailored to be trauma-informed from the outset, preventing re-traumatization and promoting engagement. This proactive approach ensures that individuals receive the most appropriate and supportive care, recognizing that trauma can underlie a wide range of presenting concerns. Following a positive screen, a more comprehensive trauma assessment is necessary to gather detailed information about the nature, timing, and impact of the traumatic experiences. This assessment explores the individual's trauma history, their current symptoms, coping strategies, and areas of strength and resilience. It may involve structured interviews, self-report questionnaires, and clinical observations. Key areas of inquiry include types of trauma experienced, age of onset and duration, impact on various life domains, e.g., relationships, work, health, presence of PTSD, dissociation, or other trauma-related symptoms, current safety concerns, available support systems. The assessment process should be collaborative, empowering the individual to share their story at their own pace and comfort level. It is vital to avoid re-traumatization during this process by ensuring a sense of control, offering breaks, and validating their experiences. The information gathered from a thorough assessment informs the development of an individualized, trauma-informed care plan that addresses specific needs and promotes healing. This detailed understanding allows professionals to tailor interventions that are truly responsive to the unique challenges and strengths of each trauma survivor, fostering a path towards recovery and well-being. Creating a trauma-informed environment. Creating a trauma-informed environment involves intentionally designing physical spaces, policies, and procedures to promote safety, trust, and healing for individuals who have experienced trauma. The physical environment should be welcoming, calming, and predictable, minimizing potential triggers and maximizing comfort. This might include soft lighting, comfortable seating arrangements, private spaces for reflection, clear signage and wayfinding, minimal clutter. Beyond aesthetics, the environment should convey respect and dignity, with attention to cleanliness and a sense of order. Policies and procedures must be transparent, consistent, and clearly communicated, reducing uncertainty and fostering a sense of predictability. This includes clear explanations of what to expect, who will be involved, and how decisions are made. Staff should be trained to understand the impact of the physical environment on trauma survivors and to actively contribute to creating a safe and supportive atmosphere. The goal is to transform the environment from a potential source of anxiety or re-traumatization into a sanctuary where individuals feel secure enough to engage in their healing journey. This holistic approach recognizes that every aspect of an organization, from its physical layout to its operational guidelines, can either support or hinder a trauma survivor's recovery. Beyond physical and procedural aspects, a trauma-informed environment cultivates a culture of empathy, respect, and collaboration among staff and with clients. This involves fostering open communication, active listening, and a non-judgmental approach to understanding behaviors. Staff training on trauma's impact, vicarious trauma, and self-care is essential to ensure that providers are equipped to deliver care effectively and sustainably. Policies should promote client choice and empowerment, allowing individuals to have a say in their care and treatment plans. Furthermore, a trauma-informed environment actively addresses power imbalances, striving for mutuality and shared decision-making. It also integrates an understanding of cultural, historical, and gender-specific issues, ensuring that the environment is inclusive and responsive to diverse needs. Regular feedback mechanisms from clients and staff are crucial for continuous improvement and to ensure that the environment remains truly trauma-informed. By embedding these principles into the very fabric of an organization, a trauma-informed environment becomes a powerful catalyst for healing, fostering resilience and promoting long-term well-being for all who enter its doors. Building resilience and coping skills. Building resilience and developing effective coping skills are central to the healing process for trauma survivors. Resilience refers to an individual's ability to adapt and thrive in the face of adversity, bouncing back from difficult experiences. While trauma can significantly challenge resilience, it is not a fixed trait, but rather a capacity that can be strengthened through targeted interventions and supportive environments. Coping skills are the practical strategies individuals use to manage stress, regulate emotions, and navigate challenging situations. These skills can be behavioral, cognitive, or emotional, and they help individuals to reduce distress, improve problem-solving, and maintain a sense of control. Examples include mindfulness practices, deep breathing exercises, journaling, engaging in creative arts, seeking social support. Teaching and reinforcing these skills empowers individuals to respond to triggers and stressors in healthier ways, rather than resorting to maladaptive coping mechanisms. A trauma-informed approach recognizes that individuals may not have had the opportunity to develop these skills due to their traumatic experiences, and therefore actively supports their acquisition and practice. This focus on skill building is crucial for fostering long-term well-being and preventing future re-traumatization. Effective resilience-building strategies often involve fostering a strong sense of self-efficacy, promoting positive self-talk, and encouraging the development of a supportive social network. Helping individuals identify and leverage their personal strengths and resources can significantly enhance their belief in their ability to overcome challenges. Cognitive restructuring techniques can assist in challenging negative thought patterns that often arise from trauma, replacing them with more balanced and realistic perspectives. Furthermore, promoting healthy lifestyle choices such as regular exercise, balanced nutrition, and adequate sleep plays a vital role in regulating the nervous system and improving overall mental and physical health. The role of social connection cannot be overstated. Fostering healthy relationships and engaging in community activities can provide a sense of belonging and reduce isolation, which are protective factors against the long-term effects of trauma. Trauma-informed care integrates these various strategies, providing a holistic framework for supporting individuals in building robust resilience and a diverse repertoire of coping skills. By empowering individuals with these tools, professionals contribute to their capacity for self-regulation, emotional mastery, and ultimately, a more fulfilling and stable life post-trauma. Therapeutic interventions. Overview. Therapeutic interventions for trauma are diverse, evidence-based approaches designed to help individuals process traumatic experiences, alleviate symptoms, and develop healthier coping mechanisms. The selection of an intervention is highly individualized. Depending on the type and severity of trauma, the individual's developmental stage, and their specific needs and preferences. While the goal is always healing, the pathways to achieving it can vary significantly. Common therapeutic modalities often focus on stabilization and safety, processing traumatic memories, reintegration, and meaning-making. These stages are not always linear and may involve moving back and forth as individuals progress in their recovery. A trauma-informed approach to therapy emphasizes creating a safe and trusting therapeutic relationship, empowering the client with choice, and respecting their pace. It is crucial for therapists to be trained in trauma-specific interventions and to understand the neurobiological and psychological impacts of trauma to provide effective and sensitive care. This foundational understanding ensures that interventions are not only clinically sound, but also delivered in a manner that supports the client's overall well-being and avoids re-traumatization. Among the widely recognized therapeutic interventions are cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT. CBT for trauma, often adapted as trauma-focused CBT, TF-CBT, helps individuals identify and challenge distorted thoughts and beliefs related to their trauma, develop coping skills, and gradually expose themselves to trauma-related memories in a safe and controlled manner. It focuses on the interplay between thoughts, feelings, and behaviors, aiming to modify maladaptive patterns. DBT, originally developed for individuals with borderline personality disorder, has proven highly effective for trauma survivors, particularly those struggling with emotional dysregulation, self-harm, and interpersonal difficulties. DBT emphasizes 4 core skill modules: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Both CBT and DBT provide structured, skill-based approaches that empower individuals to manage their symptoms, improve their functioning, and build a more stable and fulfilling life. These therapies underscore the importance of practical tools and strategies in the healing process, enabling individuals to actively participate in their own recovery and develop lasting resilience against the ongoing effects of trauma. Therapeutic interventions, EMDR, and somatic approaches. Eye movement desensitization and reprocessing, EMDR, is another highly effective therapeutic intervention for trauma, particularly for PTSD. EMDR therapy helps individuals process distressing memories and reduce their lasting effects. It involves recalling traumatic memories while simultaneously engaging in bilateral stimulation, such as guided eye movements, taps, or tones. This bilateral stimulation is thought to facilitate the brain's natural ability to process and integrate traumatic memories, similar to what happens during REM sleep. Through EMDR, the emotional charge associated with traumatic memories can be significantly reduced, allowing individuals to reprocess the event in a less distressing way and integrate it into a healthier narrative. EMDR does not erase memories, but rather changes how they are stored in the brain, reducing their power to trigger intense emotional and physiological responses. This therapy is typically conducted in a structured, phased approach, ensuring client safety and readiness for processing. EMDR has demonstrated significant efficacy in numerous studies, making it a frontline treatment for trauma-related disorders. It offers a unique pathway to healing by directly addressing the neurological impact of trauma, helping individuals to move beyond the grip of past events and reclaim their present. Somatic approaches to trauma therapy focus on the body's role in storing and releasing traumatic stress. These therapies recognize that trauma is not just a psychological event, but also a physiological one, deeply impacting the nervous system and leading to chronic tension, hyperarousal, or numbing in the body. Somatic experiencing, SE, developed by Peter Levine, helps individuals become aware of their bodily sensations, somatic experiencing, and track the discharge of stored traumatic energy. It involves gently guiding clients to notice and complete the natural physiological responses. Example, fight, flight, freeze, that may have been interrupted or overwhelmed during the traumatic event. Other somatic therapies include sensorimotor psychotherapy and trauma-sensitive yoga, all aiming to help individuals regulate their nervous system, increase body awareness, and release chronic tension. These approaches empower individuals to reconnect with their bodies in a safe and gentle way, fostering a sense of grounding and self-regulation. By addressing the physiological manifestations of trauma, somatic therapies provide a powerful complement to cognitive and emotional processing, offering a holistic path to healing that integrates mind and body. This integration is crucial for deep and lasting recovery, as it helps individuals to restore their natural capacity for self-regulation and well-being. Working with specific populations, children and adolescents. Working with children and adolescents who have experienced trauma requires specialized, age-appropriate, and developmentally sensitive approaches. Trauma in early life can profoundly impact brain development, attachment, and the acquisition of social-emotional skills, leading to unique presentations and needs. Interventions must be tailored to the child's cognitive and emotional capacity, often utilizing play therapy, art therapy, or sand tray therapy to help them express and process their experiences non-verbally. Family involvement is crucial, as the family system is often a primary source of support and can also be a source of ongoing stress or healing. Educating parents and caregivers about the impact of trauma on child development and equipping them with trauma-informed parenting strategies is essential. Creating safe, predictable, and nurturing environments at home and in school is paramount to fostering a sense of security and promoting healthy development. Professionals must also be aware of the signs of trauma in children, which can manifest as behavioral problems, academic difficulties, or physical complaints, and avoid misinterpreting these as intentional defiance. A trauma-informed approach for this population focuses on building resilience, strengthening coping skills, and restoring a sense of safety and connection, recognizing that early intervention can significantly alter long-term trajectories. Adolescents present unique challenges and opportunities in trauma-informed care due to their developmental stage, which involves identity formation, increased independence, and peer influence. Trauma-informed approaches for adolescents often integrate elements of individual therapy, group therapy, and family therapy. Interventions like trauma-focused cognitive behavioral therapy, TFCBT, are adapted to address their cognitive abilities and social contexts, helping them process memories, manage symptoms, and develop healthy coping strategies. Peer support can be particularly impactful for adolescents, as they often seek validation and understanding from their peers. Creating safe spaces where they can share their experiences without judgment and learn from others who have faced similar challenges is vital. Furthermore, Addressing risk-taking behaviors, substance use, and difficulties in relationships requires a nuanced approach that acknowledges these as potential coping mechanisms rather than simply problematic behaviors. Empowering adolescents with voice and choice in their treatment, respecting their autonomy, and fostering their strengths are critical for engagement and successful outcomes. By providing developmentally appropriate, comprehensive, and compassionate care, professionals can help children and adolescents heal from trauma, build resilience, and develop the skills necessary to thrive in adulthood, breaking cycles of intergenerational trauma and fostering a brighter future. Working with specific populations, adults and families, trauma-informed care for adults and families recognizes that the impact of trauma can manifest in complex ways throughout adulthood, affecting individual well-being, relationships, and family dynamics. Adult survivors may present with chronic mental health conditions, substance use disorders, difficulties in employment, and challenges in parenting or intimate relationships. Interventions for adults often focus on processing past trauma, developing advanced coping skills, and addressing the long-term consequences on their lives. Individual therapy, such as EMDR, CBT, or DBT, is commonly utilized to help individuals manage symptoms and integrate their traumatic experiences. However, a crucial aspect of adult care is understanding that individuals are often part of a family system, and their trauma can impact and be impacted by their family members. Therefore, a trauma-informed approach extends beyond the individual to consider the entire family unit, recognizing that healing is often a collective process. This holistic perspective ensures that interventions address not only the individual's needs, but also the broader relational context in which they live, fostering a more comprehensive and sustainable recovery. Family therapy, when delivered through a trauma-informed lens, can be highly effective in helping families understand the impact of trauma on their loved one and on the family system as a whole. It provides a safe space for family members to communicate openly, process their own reactions to the trauma, and develop supportive strategies. This might involve psychoeducation about trauma, improving communication patterns, setting healthy boundaries, and rebuilding trust that may have been eroded by trauma's effects. For parents who are trauma survivors, trauma-informed parenting interventions can help them understand how their own experiences might influence their parenting style and equip them with tools to create a safe and nurturing environment for their children. The goal is to break intergenerational cycles of trauma by fostering healthy attachment, emotional regulation, and resilience within the family unit. By engaging the entire family in the healing process, trauma-informed care for adults and families promotes the systemic shift towards greater understanding, empathy, and support. This collaborative approach empowers families to navigate the challenges of trauma together, strengthening their bonds and creating a foundation for lasting well-being and recovery for all members. Working with specific populations, vulnerable groups. Trauma-informed care is particularly vital when working with vulnerable groups who often experience disproportionately high rates of trauma due to systemic oppression, violence, and marginalization. These populations include refugees and asylum seekers, veterans and military personnel, individuals experiencing homelessness, LGBTQ+ individuals, racial and ethnic minorities, indigenous communities. Each group faces unique stresses and forms of trauma, often compounded by historical injustices, discrimination, and lack of access to culturally competent services. For refugees, trauma may stem from war, persecution, and displacement, coupled with the challenges of resettlement. Veterans often grapple with combat-related trauma, moral injury, and the difficulties of reintegration into civilian life. Understanding the specific contexts and forms of trauma experienced by these groups is paramount to providing effective and equitable care. A trauma-informed approach for vulnerable populations emphasizes cultural humility, advocacy, and addressing systemic barriers to healing. It recognizes that trauma is not solely an individual experience. but is deeply intertwined with social, political, and economic factors. This nuanced understanding ensures that interventions are not only clinically appropriate, but also culturally sensitive and contextually relevant, promoting healing within a broader framework of social justice. Providing trauma-informed care to vulnerable groups requires a multifaceted approach that integrates individual-level interventions with systemic advocacy and community-based support. For Indigenous communities, acknowledging and addressing historical trauma, such as the legacy of residential schools or colonization, is critical. This involves supporting traditional healing practices and empowering community-led initiatives. For LGBTQ+ individuals, care must be affirming and sensitive to experiences of discrimination, hate crimes, and family rejection. Veterans benefit from specialized programs that understand military culture and the unique challenges of combat trauma. Addressing homelessness requires integrated services that provide stable housing alongside mental health and substance abuse treatment, all delivered through a trauma-informed lens. The focus is on creating safe, inclusive, and empowering environments that validate their experiences, respect their identities, and address the root causes of their vulnerability. This often involves collaborating with community leaders, cultural experts, and advocacy groups to ensure that services are truly responsive and accessible. By prioritizing the needs of vulnerable populations, trauma-informed care strives to reduce health disparities, promote social equity, and foster resilience within communities that have historically faced immense adversity. This commitment to justice and equity is a cornerstone of truly comprehensive trauma-informed practice, ensuring that healing is accessible to all, regardless of their background or circumstances. Vicarious trauma and compassion fatigue. Vicarious trauma, also known as secondary traumatic stress, refers to the emotional residue of exposure to working with people who have experienced trauma. It is an occupational hazard for professionals in fields such as social work, counseling, healthcare, and emergency services. Unlike burnout, which is characterized by exhaustion and cynicism, vicarious trauma involves a profound shift in the helper's worldview and sense of self. Symptoms can include changes in spiritual beliefs, difficulty with emotional regulation, increased anxiety or fear, sleep disturbances, intrusive thoughts or images related to client's trauma, a sense of hopelessness or cynicism. This transformation occurs as professionals internalize and process the traumatic experiences of their clients, leading to a cumulative emotional burden. Recognizing the signs of vicarious trauma is crucial for professionals to protect their own well-being and maintain their capacity to provide effective care. It highlights the importance of organizational support and individual self-care strategies to mitigate these pervasive effects. Understanding this phenomenon is a cornerstone of trauma-informed care, as it acknowledges the profound impact of this work on those who serve. Compassion fatigue is closely related to vicarious trauma and is often described as the cost of caring for others who are suffering. It is a state of emotional and physical exhaustion that can result from prolonged exposure to the stress and suffering of others. While vicarious trauma is a deeper, worldview-altering experience, compassion fatigue is more about the emotional and physical toll of empathy. Symptoms include reduced empathy, irritability, difficulty concentrating, physical symptoms like headaches or stomach aches, feelings of helplessness or hopelessness. Both vicarious trauma and compassion fatigue can significantly impair a professional's ability to provide effective care, leading to decreased job satisfaction, absenteeism, and even leaving the profession. Therefore, trauma-informed organizations must prioritize the well-being of their staff by implementing strategies to prevent and address these issues. This includes providing regular supervision, opportunities for debriefing, access to mental health support, and promoting a culture of self-care. By recognizing and actively mitigating the risks of vicarious trauma and compassion fatigue, organizations can ensure the sustainability of their workforce and the continued delivery of high-quality, compassionate care to trauma survivors. This commitment to staff well-being is not just an ethical imperative, but a practical necessity for effective trauma-informed practice. Self-care strategies for professionals. Implementing effective self-care strategies is not a luxury, but a professional imperative for individuals working in trauma-informed care. Given the high risk of vicarious trauma and compassion fatigue, proactive self-care is essential for maintaining well-being, preventing burnout, and sustaining the capacity to provide high-quality care. Self-care encompasses a wide range of activities aimed at nurturing one's physical, emotional, and cognitive state at LEM interactions and academic performance. Mental and spiritual health. It involves consciously engaging in practices that replenish energy, reduce stress, and promote a sense of balance. Examples include regular physical exercise, mindfulness and meditation, sufficient sleep, healthy nutrition, engaging in hobbies and leisure activities, spending time in nature. These practices help to regulate the nervous system, process emotional experiences, and build resilience against the cumulative effects of working with trauma. Organizations also play a crucial role in promoting self-care by fostering a supportive culture that values employee well-being and provides resources for stress management. Prioritizing self-care ensures that professionals can continue their vital work without sacrificing their own health and effectiveness, ultimately benefiting both themselves and the clients they serve. Beyond individual practices, self-care also involves establishing healthy professional boundaries and seeking supervision and peer support. Setting clear boundaries between work and personal life helps to prevent emotional spillover and maintain a sense of control. This might include limiting work-related discussions outside of work hours or consciously disengaging from client stories when not on duty. Regular, high-quality supervision provides a safe space for professionals to process challenging cases, receive guidance, and reflect on their own emotional responses, thereby mitigating the impact of vicarious trauma. Engaging in peer support groups or informal networks with colleagues offers opportunities for shared understanding, validation, and mutual encouragement, reducing feelings of isolation. Furthermore, advocating for organizational policies that support work-life balance, reasonable caseloads, and access to mental health services is a collective self-care strategy. By integrating these individual and systemic approaches, professionals can build a robust self-care framework that sustains their well-being and enhances their effectiveness in the demanding field of trauma-informed care. This holistic approach to self-care is a testament to the understanding that caring for others begins with caring for oneself, ensuring a sustainable and compassionate workforce. Organizational implementation of TIC. Organizational implementation of trauma-informed care, TIC, requires a systemic and comprehensive approach that permeates every level of an institution, from leadership and policymaking to direct service delivery. It is not merely a program or a set of interventions, but a fundamental shift in organizational culture, values, and practices. The process typically begins with a commitment from leadership, who must champion the initiative, allocate resources, and model trauma-informed principles. Key steps include conducting an organizational self-assessment to identify current strengths and areas for improvement, developing a strategic plan with clear goals and timelines, providing comprehensive training for all staff, from frontline workers to administrators, revising policies and procedures to align with trauma-informed principles. This foundational work ensures that the entire organization understands the impact of trauma and is equipped to respond in a sensitive and effective manner. It moves beyond individual staff training to embed trauma-informed practices into the very fabric of the organization, creating a consistent and supportive environment for both clients and staff. This commitment to systemic change is crucial for sustained and effective implementation of TIC. Sustaining organizational TIC implementation requires ongoing effort, continuous evaluation, and a commitment to fostering a trauma-informed culture. This involves establishing mechanisms for regular feedback from clients and staff to assess the effectiveness of trauma-informed practices and identify areas for refinement. Continuous professional development and booster trainings are essential to reinforce learning, introduce new knowledge, and address emerging challenges. Creating a supportive internal environment for staff, which includes addressing vicarious trauma and promoting self-care, is also critical for sustaining the workforce and preventing burnout. Furthermore, organizations must build strong partnerships with community stakeholders, including other service providers, advocacy groups, and individuals with lived experience, to create a broader network of trauma-informed support. This collaborative approach ensures that TIC is integrated into the wider service system, promoting a more cohesive and effective response to trauma in the community. By embedding TIC into its core identity, an organization can transform its operations to genuinely promote healing, resilience, and well-being for all individuals it serves, becoming a beacon of compassionate and effective care. Challenges and barriers to TIC implementation. Implementing trauma-informed care, TIC, is a complex undertaking that often encounters significant challenges and barriers within organizations and systems. One primary barrier is resistance to change, stemming from ingrained practices, fear of the unknown, or a lack of understanding about the necessity and benefits of TIC. Staff may feel overwhelmed by the additional training requirements or perceive TIC as an added burden to their already demanding workloads. Another significant challenge is resource limitations, including insufficient funding for training, hiring trauma-informed staff, or adapting physical environments. Organizations may struggle to allocate the necessary time and financial investment, particularly in under-resourced sectors. Furthermore, a lack of consistent leadership buy-in or high staff turnover can disrupt implementation efforts, leading to inconsistent application of principles and a loss of momentum. These internal factors can create a climate where TIC is viewed as a temporary initiative rather than a fundamental shift in practice, hindering its successful integration. Addressing these challenges requires strategic planning, persistent advocacy, and a clear articulation of the long-term benefits of TIC. Beyond internal organizational factors, external systemic barriers can also impede TIC implementation. These include fragmented service delivery systems that lack coordination and communication, policy and funding structures that do not explicitly support trauma-informed approaches, societal stigma surrounding mental health and trauma, which can deter individuals from seeking help, a lack of a skilled workforce trained in trauma-informed practices. The absence of a robust, integrated system of care can make it difficult for organizations to sustain TIC efforts, as they operate within a broader environment that may not share the same principles. Overcoming these barriers requires a multi-level approach involving policy advocacy, interagency collaboration, and public education campaigns to shift societal attitudes. It also necessitates a commitment to ongoing evaluation and adaptation. Recognizing that implementation is an iterative process that requires flexibility and responsiveness to emerging challenges. By proactively identifying and addressing these challenges, organizations can navigate the complexities of TIC implementation more effectively, ultimately fostering environments that are truly healing and supportive for trauma survivors. This commitment to overcoming barriers is essential for realizing the full potential of trauma-informed care and creating a more compassionate and effective service landscape. Ethical considerations in trauma-informed care. Ethical considerations are paramount in trauma-informed care, guiding professionals to practice with integrity, respect, and a deep commitment to client well-being. The principles of beneficence, doing good, and non-maleficence, doing no harm, are particularly critical, requiring practitioners to prioritize client safety, and avoid re-traumatization at all costs. Confidentiality is another cornerstone, as trauma survivors often share highly sensitive and vulnerable information. Maintaining strict confidentiality builds trust and creates a safe space for disclosure. Informed consent is equally vital, ensuring clients fully understand the nature of services, potential risks and benefits, and their right to refuse or withdraw at any time, thereby restoring a sense of control. Professionals must also be acutely aware of power dynamics inherent in therapeutic relationships, actively working to minimize imbalances and empower clients. This includes respecting client autonomy, fostering shared decision-making, and avoiding any actions that could be perceived as coercive or controlling. Adhering to these ethical guidelines is not merely a matter of compliance, but a fundamental aspect of providing truly trauma-informed and healing services, ensuring that clients are treated with the utmost dignity and respect throughout their recovery journey. Boundaries and scope of practice are additional critical ethical considerations in trauma-informed care. Clear professional boundaries are essential to maintain the integrity of the therapeutic relationship, prevent exploitation, and protect both the client and the professional. This includes avoiding dual relationships, maintaining appropriate self-disclosure, managing personal biases. Professionals must operate within their scope of practice, ensuring they possess the necessary training, competence, and supervision to address the complex needs of trauma survivors. Referring clients to specialists when their needs exceed one's expertise is an ethical imperative. Furthermore, cultural competence and humility are ethical responsibilities, requiring professionals to understand and respect diverse cultural contexts, beliefs, and healing practices. This involves ongoing self-reflection and a commitment to learning, ensuring that care is culturally responsive and avoids imposing dominant cultural norms. Addressing vicarious trauma and promoting self-care are also ethical duties, as a professional's well-being directly impacts their ability to provide ethical and effective care. By consistently upholding these ethical principles, trauma-informed care ensures that services are delivered with the highest standards of professionalism, compassion, and client-centeredness, fostering a safe and trustworthy environment where healing can genuinely flourish. Future directions in trauma-informed care. The field of trauma-informed care, TIC, is continuously evolving, with future directions focusing on deeper integration, broader application, and enhanced evidence-based practices. One key area of growth is the further integration of neurobiological understanding into therapeutic interventions, leading to more targeted and effective treatments that address the brain's response to trauma. There is also a growing emphasis on prevention, moving beyond responding to trauma to proactively building resilient communities and mitigating adverse experiences before they occur. This includes public health initiatives, early childhood interventions, and systemic changes that address social determinants of health. Furthermore, the application of TIC is expanding into new sectors such as criminal justice, housing, and environmental design, recognizing that trauma's impact is pervasive across all aspects of society. This broader application requires cross-sector collaboration and a shared understanding of trauma-informed principles. The future of TIC is about creating a truly compassionate and responsive society where the widespread impact of trauma is understood, acknowledged, and effectively addressed at every level. This forward-looking perspective ensures that TIC remains dynamic and responsive to the evolving needs of individuals and communities. Future directions in trauma-informed care also include a stronger focus on research and evaluation to build a more robust evidence base for various interventions and implementation strategies. This involves developing more sophisticated outcome measures, conducting longitudinal studies, and exploring the effectiveness of TIC in diverse populations and settings. Technology will likely play an increasingly important role, with innovations in digital health, virtual reality, and artificial intelligence offering new avenues for assessment, intervention delivery, and training. Advocacy efforts will continue to be crucial in shaping policy, securing funding, and promoting systemic change that supports trauma-informed approaches at local, national, and international levels. There is also a growing recognition of the importance of co-design involving individuals with lived experience in the development and delivery of services, ensuring that interventions are truly client-centered and effective. By embracing these future directions, trauma-informed care aims to become even more impactful, equitable, and sustainable, ultimately fostering a world where healing from trauma is accessible to all, and where communities are built on principles of safety, trust, and resilience. This ongoing commitment to innovation and improvement will solidify TIC as a cornerstone of public health and social justice.